Taking a live look outside through our Jacksonville Beach Skycam, you can see it's a beautiful start to our morning, and a lot of people will most likely be heading out there this weekend to enjoy the sand and the sunshine. But it's important to remember to protect yourself from the sun. And as we're heading into summer, even if you're not planning to spend a lot of time outside, in fact, statistics show about 20% of all Americans will develop some form of skin cancer in their lives by age 70. With that in mind, we're talking to Dr. Naiara Barbosa, who is a Mayo Clinic dermatologist, about skin cancer risk and how to be safe. Good morning, Dr. Barbosa. Thank you so much for joining us.
Thank you for having me.
So first, can you just tell us, I already know that I'm already at risk, but who is most at risk for skin cancer?
Yeah, so anyone can get skin cancer. So I think it's really good to keep that in mind, regardless of your age, the color of your skin, your gender. But obviously people who have fair skin, and if you spend a lot of time outside, and I know in Florida, we are very lucky to have so much sunshine. So spending a lot of time outdoors, having a lot of sun exposure can also increase your risk of skin cancer, as well as using tanning beds. And as you already mentioned, as you get older, because you're accumulating that sun damage, you also can be at increased risk.
And what is the easiest way to know if you have skin cancer, and what types of treatments are typically available for patients with melanoma?
Yeah, so what we usually recommend is that you do a self-skin check. And I know that can be hard to look at your back, but you can try to use a mirror or have a partner help you look. So there are three major types of skin cancers: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell and squamous cell, they might look like a bump, a pimple or a bug bite that is not healing, so something that is there but not behaving appropriately. They might hurt, they might bleed, and they'll be growing over time. So those are lesions that we get concerned. For the melanoma, we usually use the ABCDE criteria. So any dark spot or a mole that is A, asymmetrical, B, has irregular borders, C, color, so a lesion that has multiple colors, especially very dark or red, D, the diameter, so bigger than a pencil eraser, and E, evolving, so anything that is changing. So you might have a mole that has been there for many years, but now is starting to bleed or is growing in size. You definitely want to have that checked. And if you're concerned, definitely go see a board-certified dermatologist.
And we often hear about a procedure called Mohs surgery for skin cancer patients. What is that?
Yeah, so Mohs surgery is a technique that we use to remove skin cancers, and is used for skin cancers that are considered higher risk, which are usually skin cancers on your face or the top of your head, on your ears. Those are also cosmetically sensitive areas. So with Mohs surgery, and that's what I actually do most of my time, we are removing the cancer, but we are able to really minimize how much healthy skin we are removing. So we can give you the highest cure rate, at the same time minimizing your scar. We have the ability to check the margins during the procedure, and it is an outpatient procedure, which means you're awake the entire time. We just use local anesthetic, and we can give you the highest cure rate and the best cosmetic outcome.
All right, and can you just tell us real quick about what age and how often should you go and see a dermatologist?
Yeah, so we don't have specific guidelines. What I usually tell people, so it's easy if you already have a skin cancer. So if you have a history of skin cancer, we recommend that you see a dermatologist every 6 or 12 months for a full body skin check. Also, if you have a family history of skin cancer, so if a relative like your parents, your siblings, your kids have a history of skin cancer, you might want to have that checked as well. Otherwise, it's really based on your concern. Sometimes people like to have a baseline skin check so they feel good and they're like, things are okay and I can just do it every few years. But obviously, if you notice something concerning, again, just call a dermatologist and have that checked.
All right. And of course, never forget to wear sunscreen. Thank you so much, Dr. Barbosa, for joining us this morning.
Thank you. My pleasure.